So with that, I see Brooke is here. Let me just play her music really quickly because people work hard to get their songs. Yeah! All right. Take it away, Brooke. Thank you.
Awesome. Thank you so much, Jared. Sorry for the delay. We had a whole keynote with some animations and we couldn't share it. So we're going to do this PowerPoint and do it live. But hi, thanks. My name is Brooke Madubuonwu. I am the Director of Legal Analytics and Quantitative Research at the ACLU. So for folks who don't know what the ACLU is, we're an organization that uses primarily litigation and advocacy to enhance and promote civil rights and civil liberties in the US. And a big area of work for us is improving the rights of folks who are involved in the criminal legal system. And so part of my work on the analytics team is to support the work of our advocates and lawyers. So I'm going to talk today about a project we did to model the spread of COVID-19 in jails. We're going to talk about why we're focusing on jails in particular, but some of these sort of takeaways do extend to prisons and immigration detention centers, other detention facilities. We're going to talk about modeling a single jail outbreak and then the challenges of scaling that up in R, and then talk about sort of the takeaways. So first, why focus on jails? I think we can kind of start from where we are now. And what we know about what's going on in jails and prisons right now. 10 of the largest 10 COVID-19 hotspots in the US are in jails or prisons. I think something like between 2/3 and 3/4 of the 100 biggest outbreaks are in jails and prisons. These are real hotbeds for spread. And this has already been, we did this work back in April, and unfortunately, we're seeing a lot of the adverse outcomes that we anticipated bear out in these systems. And there are a lot of reasons why this is the case. Jail and prison and immigration detention centers are super overcrowded very frequently. The sanitation is really a challenge in these systems. There's poor ventilation. There's sort of dilapidated conditions. People who are incarcerated are often required to provide to purchase their own hygiene materials at, on the sort of inhumane wages that they're given for working in these prison systems. So it's really a volcano ready to explode. So back in March and April, activists were already sounding the alarm around this, and we were lucky enough to work with 3 academics, Eric Lofgren, Christiane Loom, and Nina Pfefferman, along with my colleague Aaron Horowitz at the ACLU, to build an epidemiological model of what would happen to the spread in these systems. So first, I want to talk about modeling that one outbreak. A little primer for folks who aren't familiar with epidemiological models, although many more of us are than used to be in the past, unfortunately, because of what's going on right now. Essentially, in a compartmental epidemiological model, you move from being susceptible to a particular infection to being exposed, to being infectious and able to spread it to others. And then if you do not die from that infection, you are recovered. And so we can use a system of differential equations to model sort of the transmission of a disease through a population. This is what that looks like in math. If folks are sort of mathy, this can be a little bit intimidating, but basically it's just saying that the rate of transition between these states is a function of some of the natural disease parameters. So with COVID, there are sort of average ranges that you spend in the pre-infectious period, the E compartment, the exposed compartment, and the infectious compartment, for example. And it's also a function of the effective contact between individuals who are infectious and who are susceptible. So that itself is a function of both natural history parameters of the disease, but also things like how often people are coming into effective contact. So this is what a really, really basic compartmental model looks like. In R, we use the desolve package, and it's essentially just putting this up here into code. It's pretty straightforward. This is a really simplistic version of the model, and I don't want to spend too much time talking about this. I want to talk about the challenges of scaling that up. This is, so we were going through pictures, math, and code. This is the picture of what our model looks like. So not only are you moving through S, E, I, and R compartments, but you can also move from the community through to booking and processing through the jail system. And we parameterize this using real values from Allegheny County jail system, which published really, really complete, thorough sort of estimates of how many people are being arrested every day, how many of those people are being booked into jail, how many people in jail have a trial on any given day, et cetera. Just briefly, that's what that looks like in math in our paper. It's very complicated, but it's not very complex. It's straightforward as long as you can get all of the parameters right. And again, this is what this looks like in code. It's a lot, but it's, again, straightforward once you can get, and which is to say, once you can wrangle a bunch of academics to do all the hard stuff for you. This is what the baseline looks like. If we do nothing, the disease spreads through the jail at a much higher rate than through the community, and that's because people in jails are coming into effective contact at a much higher frequency than people who are just in a community. So essentially, the first step of this was taking parameterizing that model to one particular system, running all of our code. That was the focus of the paper. And then we wanted to see sort of what is the national scale of, what is the impact at a national level if this outbreak happens in every jail. And so we looked at every single jail with a jail population of over 100 people, which accounts for around 90% of the population in the US live in a county with one of these jails, and used a lot of open data that is made available to parameterize these outbreaks. So I want to talk about 4 challenges of scaling up a single model in one community to essentially the nation. So challenge 1, we had all this great information from Allegheny County about the rates of movement from jail to court, the rates of how frequently people are arrested, the average length of detention, the size of the incarcerated population, the size of the jail staff who are moving through these systems. But we wanted to go from that one place to localizing this in various counties. And so that involves some parameters that are natural disease history parameters of COVID-19, and some sort of custom pieces of information from different places. And this was only possible because of open data sets that we were able to use largely from the Vera Institute. We used, again, a lot of information specific to Allegheny County. We used some Census of Jails data from the Bureau of Justice Statistics. We used New York Times data to understand, how far along in the communities were each of these infections at the time that we were modeling them. And so that was this research was only possible because of open public data. We talked earlier about the importance of open data and also open science in this process. So that was a huge win for us. The second challenge was parallelizing this model. So straightforward enough to run to solve a set of differential equations in one place. We looked at 6 different scenarios and various assumptions in each scenario. And this is manageable, but then we ran that across over 1,200 jurisdictions and had hourly time points for each. So that ended up to be a lot of simulations. And so the solution to that challenge, thankfully, was very straightforward in our, because of the future and fur packages, the latter of which I'm now learning, I think today is launching some big updates. But this allowed us to essentially write the code the same way we would have if we're just doing building one model and split it across 96 cores, again, using some EC2 instances that we spun up. So this is what this looks like. If folks are users of the PER package, we mapped some functions over a list of different scenarios and parameterized that with a certain sort of like starting conditions based on that locality, certain parameters, and ran it for a given number of days. And we're able to do the same thing using FIR. So the syntax is really similar. This is a different function, obviously. but that allowed us to get this done in less than months, which is what it might have taken otherwise. The third thing I wanted to talk about was in testing. This is sort of lessons learned from this process. And one of the lessons that we learned in scaling up was that we weren't going to be able to look at pictures to test. So when we were building our original model, we diagnosed bugs in our code based on just looking at output. So there was a period of time where we were trying to troubleshoot this one thing that was happening where no matter which version that no matter which simulation that we were using and which scenario we were looking at, we were getting just people in the population falling off, completely vanishing from all of the compartments. And this is not because people are dying from the disease, because those people remain in the compartments. This is just people disappearing because one of our terms wasn't paired. So we were able to test visually when we're modeling just one outbreak, but that's not really feasible when we have 20,000 models. And so we were lucky enough at the ACLU to be able to bring in our data engineering team. I think that's my recommendation strongly, but that's not available to everyone. And so you can definitely bring in data engineering best practices, one of which is testing and making sure that you're building in your assumptions and failing pretty loudly when your code is not meeting your assumptions. Challenge number 4 that I wanted to talk about that I think has been mentioned in this kind of setting frequently is that when you're scaling up, often we didn't have data for specific localities. So one thing that one issue that we ran into when we were trying to scale up and seeing some weird outputs is that we had forgotten to set our seed, and we're getting different versions across multiple different outputs. And so this is, again, let me join the chorus of folks to remind you to set your seed, especially if you're in, this is a really simple imputation to estimate the size of the staff population in jail systems where we didn't know the size of the staff population. So I want to talk about some of the scenarios that we ran and some of the results, and I'm moving really quickly because this is a ton of stuff, but I'll make these slides available, and our paper is also available publicly as well. So we wanted to look at 3 main interventions to potentially reduce the impact of COVID-19 in jails. We looked at reducing intake, so reducing arrests, changing some arrests to citations, for example, and just reducing the number of arrests that are happening in the community. We looked at reducing arrests and increasing the speed of release for individuals, particularly in this case for medically vulnerable individuals. And the ACLU has taken a bunch of lawsuits arguing that essentially detaining people who are medically vulnerable in these situations is a violation of their human rights. It puts them at too great of a risk. And finally, we looked at sort of a blanket collection of actions that we could take within the jails for the people who do remain. As much as we would like it, it's not feasible right now for us to be living in a jail-free world. And so what can we do to actually protect the people who are still behind bars? And essentially what we found is that the best way to reduce transmission and to reduce infections, hospitalizations, and deaths in both the jail and in the community is to reduce arrest and bookings as much as possible. Don't bring people into the system, because when you bring people into jail systems in particular, which have very low rates or very low average lengths of detention, and in which people are often cycling back into the community, you're not only infecting those people and harming the people who are incarcerated, but you're also seeding that infection in the broader community and really exacerbating the problem. So that was the biggest thing that we could do. We also found that increasing the speed of releasing people, especially if you can act quickly and early in the outbreak before it spreads throughout the jail, ideally, then that really reduces cases and deaths in the jails and the communities, especially for medically vulnerable people. So I know these graphs are hard to read when we're moving so quickly, but in this middle row, we're looking at infections, hospitalizations, and deaths of incarcerated people, and we see a real big jump in decrease in deaths when we release medically vulnerable people from jail as quickly as we can. And finally, it's definitely necessary to do the collection of things that we know are we're supposed to do to prevent the spread of COVID-19 in the community, we have to be able to make those available in jails as well. We have to give people masks. We have to improve sanitation and hygiene. We have to reduce the population so that socially distancing is even possible. And that's necessary, but it's not enough to stop transmission. So I want to talk about sort of like when we run these 1,200 models and aggregate that together and make some pretty sort of like reasonable assumptions about death rate, about hospitalization rates based on where we were in March and the information that was available at the time. We find that across the board, reducing arrests saves lives. It saves tons of lives in the jails, but it also saves hundreds of or tens of thousands of lives in the community. This isn't just an intervention. It's a very important intervention for people who are incarcerated, but it's not just for them. It's for everybody. And this is again an example of when we do the right thing by people who are just involved and involved in the criminal legal system. It helps all of us. And this finding has been sort of corroborated by two additional studies, one in Chicago and one in Milwaukee, that essentially find that jail community cycling is a big predictor of cases of coronavirus. In Chicago, they found that this was a bigger predictor than race, a bigger predictor than poverty, than many of the other risk factors that we know contribute to COVID-19 spread, that bringing people into the jail system, often not releasing them only because they can't pay bail, is a huge risk factor. People maybe not working in this space may not know that the majority of people who are in jail are detained pre-trial. They haven't been convicted yet. And a majority of those people are only in jail because they can't afford their bail or bond, right? And so the system doesn't have to be that way. We don't have to use cash bail. These are interventions that we can take right now. And this is important because for many reasons. One, because people's lives are at risk, but it also exacerbates the racial disparities present in COVID-19 cases and deaths. So nationwide, Black people are dying at 2.5 times the rate of white people. And it's even greater, I think, when you look at age stratified rates. And that's for many reasons. But a lot of those get back to these systemic disparities. So the graph that you're seeing on the left is showing that Black people are a disproportionate number of the stops and searches in Washington, D.C. And we see that not only stops are disproportionately of Black people, but that stops that don't lead to anything. So essentially useless stops, right? Stops that probably are ones that white people wouldn't be stopped for are even more disparate, right? And a lot of evidence is sort of corroborates this. Like, we know that there are racial disparities at every sort of phase of the system. And so in the minute that I have left, I want to talk about how this is used. As of mid-July of this year, we'd filed over 161 legal actions related to COVID-19, 69 in jails and prisons, 32 of these are class actions, 51 in immigration detention. And we've also used this in successful advocacy with our partners to release over 48,000 people from detention, whether that's jail, prison, or immigration detention. So really the strength of this work is only useful if our advocates can take it and run with it. And these are the people doing the real work on the ground, frankly. But I wanted to give this one example of how statistics and data science can be used to sort of support advocacy and litigation. So thanks very much. Sorry for my technical difficulties. The report is available on the ACLU website. These slides are up on my GitHub, and then I'm on Twitter if you want to talk about it. So thanks very much.